My name is Tatiana Vladimirovna Sherbakova. I am a doctor neurologist. I work in a large private Moscow clinic. I have 18 years experience in medicine. Actually, this problem is already being discussed in medicine. Why some people are prone to frequent viral infections. They have these diseases in a severe form with complications, while other people either don't have them or have them very rarely or in an easy form. Most specialists who deal with this problem come to the conclusion that the immunity of people who get sick rarely is directly related to their psychological state. The recommendations they give for improving immunity is to experience joy, happiness, pleasure as often as possible. Now, medicine is becoming more and more evidence-based, and it is becoming more and more proven that there are no effects from drugs that stimulate immunity. And that the feeling of happiness is the factor that essentially maintains immunity at the level that allows a person to get sick rarely or to pass the same viral diseases in a very mild form. Well, and on the contrary, a lot of attention is paid to the problem of stress and its influence on a person. In fact, this has long been known. Stress is a risk factor in the development of a very large number of diseases. Quite often, doctors recommend their patients to avoid stressful situations in order to avoid exacerbations, or, for example, to prevent a person from getting this disease again, when we are discussing preventive measures. What is interesting is that patients always ask the doctor afterwards whether you managed to avoid stress, and how in reality, in practice, you can avoid it, and how in particular you can change this reaction to stress. And patients even say that they try. They try to persuade themselves somehow, to convince themselves that a certain stressful situation is no big deal, but in the vast majority of cases, they do not succeed. This is not surprising. In fact, we have no conscious influence on our unconscious. It simply does not work this way. That is, without psychoanalysis, it is almost impossible to improve your stress resistance. I have seen different techniques and their results on influencing the stress resistance of patients. And it is often a very long process, not always with predictable results. Often patients are disappointed in psychotherapy. I recommend system vector psychology because I believe that it is the most effective, the most efficient psychoanalysis for today. It is about 98% of effectiveness. I can say that other methods are significantly inferior in effectiveness. Plus, it is a high rate of stability of the result, when after many years the patients retain this effect. Patients whom I observe for many years have not returned to the states with which they came to the training on system vector psychology. Actually, most people do not understand in a global sense what stress is, that it can be individual. It is clear that we have some global stresses, such as war, some pandemics, one of which we had recently. But there is also individual stress, in which a person lives practically chronically, and they do not know how to get out of it, because they do not in fact define it. And it's very important to define what is stress for a particular person, otherwise he or she will not be able to avoid it. I mean, it will be impossible in principle. That is why it turns out that all our recommendations on avoiding a stressful situation remain formal, because a person in general does not see these stressful situations. They feel bad, they get sick, yes. But in general, the person doesn't have any generally recognized stressful situations. And without understanding one's psyche, it is absolutely impossible to figure it out. As a rule, I always ask about some psychological traumas, some stresses in a person's life. And some people get even surprised because I guess what really was. However, they did not pay attention to it, did not see the connection with their condition. Yet there is always surprise, because you always get to the point by understanding a person's psyche and the condition developed in them. That is, you see a person, you determine their psyche, and sometimes before they start talking about their problem, you already have a rough idea of what they are going to talk about. I can give you an example like this. A man has a loss of consciousness on the background of coughing. For a long time, for 3 months, he has been coughing, losing consciousness at the height of coughing. And he tells me that, in principle, it happened to him for the first time. He had never been ill. He considered himself a person with good immunity. And then this situation happened. He got sick. He has such a prolonged cough, he can't understand what is happening to him. We solved the problem with him, of course, with the loss of consciousness. We found out what he would do in order to get rid of it. But when he had a question about why this happened to him, the first thing I asked was, have you been under a lot of stress? Probably something in the family happened. He surprisingly replied to me that, yes, indeed, he had a very big family drama that he was going through very hard. And literally half a month later, about a couple of weeks after that, he became seriously ill, and the whole situation started to develop. It got to the point where he started losing consciousness. He couldn't connect those things by himself in that way. Basically, I also recommended to him the training on system vector psychology by Yuri Burlan, because otherwise any cough in his future might be accompanied by loss of consciousness. That is, if he did not get out of this stress, we could not really help him. And medicine offers us what? We offer a person just to know that on the background of coughing, he will have these attacks again, and he should be careful. That's it. That's what academic medicine offers us. But if you help him to get out of this stress, to adapt it, then he will not experience these states anymore. When a patient asks me how Yuri Burlan's psychoanalysis works, I always explain that in principle, it is possible to influence the psyche only with a word. There is no other possibility, first of all. And it is not just a word. It is a text tailored in a certain way. That's the essence of psychoanalysis. And plus, it is certain information that a person receives at the training. What does it give you in the end? It gives an understanding of one's psyche, understanding of those psychological traumas that have already been displaced into the unconscious but continue to have a negative impact on a person's life and health. And in fact, when a person realizes their trauma, it stops affecting them. And what I like about Yuri Burlan's training, that a person does this work on their own, the work of finding these psychological traumas. They understand on their own, in fact, bring to the conscious level those unconscious processes that they were driven by. This allows to build relationships with people, with surrounding ones, in the right way, to understand the reasons for people's actions, to understand why we react in one way or another in those or other situations. And naturally, a person does not automatically react negatively to stress. He then understands why this happens. It doesn't cause him to react negatively to stress. That is, stress may not go away from a person's life. There will be certain stresses. After all, we live this life, and it is filled with stresses. But what is important to us is the reaction to stress. When a person understands himself, understands others, he does not react negatively. This is very important. So it's a very deep effect, which doesn't go anywhere, because the changes happen, in fact, in the unconscious. Meaning it's not just a belief in something, but it's a very deep unconscious change, which remains forever. Like psychological traumas, they are fixed for a person's whole life. And Yuri Burlan's psychoanalysis gives a stable effect in the unconscious, but a positive one, a positive effect with which a person can live their whole life. That is, they can solve many life issues on their own without going back to work with a psychologist. In other words, this knowledge stays with them. I have nothing to compare it with. There are simply no methods like Yuri Burlan's.